there's a law currently in Nevada that doesn't allow health care professionals from other states to come in and give free health care. So how do you feel about that?
Well, that would be one of the short-term solutions, is that for events like this, if we just change that law and allow people reciprocity, that like dentists in California to come in here and practice just for humanitarian efforts and to volunteer for a very short amount of time, it would do great. We had a group in Georgia that wanted to come be a mission for us and to bring 16 dentists, and they couldn't come because they had Georgian license.
Well, I think there should be reciprocity across the whole U.S. for all dentists.
It's a real shame that those laws exist and prevent that. I think we should have some way to solve that.
Well, I would urge the elected official to support these type of events and make it as easy as possible to hold them.
I've heard a lot of local leaders say that healthcare is not a local issue, and it is a local issue. If we all keep saying it's not a local issue and we don't have a say in it, then we're not going to be able to make this better. So I invite people to come down to events like this or to participate in events like this to really see what the issue is, and then start working with all of us to start addressing the problems.
I'm not one that advocates a lot of welfare and everything, but a lot of people have worked, and right now they're out of work, and not because of, something they did.
Personally, I'm working for a temporary agency. I think that there should be some sort of offer of at least temporary insurance for those people in that, that limbo of jobs, whether they're always they have multiple temporary jobs, or whether it's just in the meantime while they find something else. I think there should be some sort of affordable insurance for people in those situations.
I think it would be great if they would have a program where we could offer more insurance programs for the lower income.
I believe every person should have access to affordable, quality health care. I would be willing to raise my taxes because I think that is the most important thing, to have a high quality of life for our families.
We're active members of the community, and when we're in pain, we can't help anybody. And to not be able to have access to health care, we haven't had it for years. And it's just hard.
I, for one, can't afford insurance, but at the same time, I could afford it if it were under the overall Medicare program. And also to be proactive instead of reactive in our services. Instead of saying, well, we're not going to take care of that. I think that if people looked at what it's costing them in the long run of taking care of people when it's too late, than to help them before it becomes too late, we're spending too much money, I believe.
Preventative medicine does reduce healthcare costs. If you can identify a problem or head off a problem before it exacerbates into something much more serious, then you're gonna reduce the cost. So that would affect, for elected officials, it would reduce spending on healthcare, and also for insurance companies.
I'd like to see more funding provided for services. If we could get more specialists, especially in our rural sites, primary care providers, it's very difficult for us to lure primary care to rural sites.
As far as the state of Nevada, we're probably the state with the highest percentage of people that need care as far as no access because of all of our rural areas that we have. This weekend is a proven fact of that we've served, as far as dentistry-wise, almost over 400 people.
I think the current state of our health care is really tragic across the board, and rural Nevada, the isolation, the lack of resources just multiplies that astronomically.
Rural Nevada needs to be recognized as a part of Nevada, that they deserve just as many services as our urban areas do.
I would say that we need to keep working at it, and it's not okay for either party to throw up their hands and say, this is, just keep saying no. I don't care if it's Democrat, I don't care if it's Republican, we need an answer. These kinds of things shouldn't be happening. We shouldn't have families that can't get served. We shouldn't have to listen to vets who can't get their dental needs met. It's embarrassing. And so we really need to continue on that solution, and we really need to continue working together for those solutions.